Hello, everyone. It's Tuesday, May the 19th. I tell you this over and over and over. We're getting closer and closer and closer to summer. We're getting closer to hotter temperatures. We're getting closer to a drug and a vaccine, and every day that goes by, we're getting better. And so I just ask you to keep everybody in your thoughts and your prayers, and let's just hope and pray that we won't get too many bumps in the road before we get to that vaccine and that drug that will really, really help us. Today, again, I've got to tell you that we've lost our 68th West Virginian, an 86-year-old female from Kanawha County, and I just go through it over and over and over, and it's a terrible thing to have to do, but I want to be really respectful to the people we've lost. I don't want them or their families in any way to ever think that they were a statistic. You know, we are deeply indebted to all the knowledge and the beauty that they gave us through their lives, and we absolutely want all of you to think about them and their loved ones and keep them in your thoughts and your prayers. Please do so. I want to read to you that we're reopening in week 4 with an executive order today that I am signing that will allow these businesses to reopen and also lifts the 14-day quarantine order for out-of-state travelers. The order will go into effect at midnight on Thursday, May 21st. Now, week 5 of our reopening plan begins on Tuesday, May 26th, and those businesses are on the screen right now. All guidance documents are posted on my website, and they should be available to you, to follow right along. Regretfully, I tell you that we have had our first positive test, in our jail system. Last night, we had a 62-year-old male at the Huttonsville Correctional Center in Randolph County that tested positive. This is the first inmate in our West Virginia Correctional Facility to contact the virus. And yesterday, DMAPS confirmed that a part-time correctional officer at Huttonsville also tested positive. However, these are believed not to be connected. Now, what we'll do is immediately we will test all inmates and staff in the block that we found this positive. Now, I think we're going to move forward to test all the staff in the entire facility. I think that's correct, and if we need be, as we test those today, if we find we have additional positives, we'll expand that testing to all the inmates in the entire facility. That's what we've got to do. We've got to be prepared to be able to run to the fire. Our National Guard, our health officials and everything are doing great work. This disease is with us. It's everywhere. And we have had wonderful, wonderful blessings that we have not had an issue in our jail systems and everything. We knew it was probably coming, and when it came, we're trying to run to the fire and make sure we put it out as quickly as possible. I want to tell you that there's a drug called Remdesivir, and West Virginia has now received a shipment of that drug from the U.S. Department of Health and Human Services. The drug is produced by a company called Gilead, and was donated to the government for use in critically ill patients with this terrible disease. I want to personally thank our president for allowing us to get some and have some of this potentially life-saving drug. And Dr. Slimp, as we go forward, will give you more details on that. I said to you yesterday, as far as our cities and our counties, the application for you to apply for dollars is up. I encourage you to do so as quickly as possible, and we will process and get those dollars moving back to you as absolutely as efficiently as we possibly can. I absolutely want you to know this, that you don't have to include everything in the kitchen sink, because there are certain guidelines that we have got to go by, and we're not going to be able to include everything in the kitchen sink. So, but as the guidelines begin to be modified more, and they are going to, as sure as I know my name, you have multiple times of applying. So all you're doing right now is applying for absolutely what you can definitely connect right back to COVID-19. Do that, and then know you're going to have many more bites at the apple that you can continue to absolutely apply. This is for expenses only at this time. This is not for backfilling revenue and everything, but I really believe with all in me that these guidelines are about to be changed, and absolutely the more significant dollars will come in the next phases. So apply now, and then we'll just do what I've said all along. We'll crawl, and then hopefully we'll be running in not long. This is the same kind of thing. The SBA came out with a program called, that was the Paycheck Protection Program, PPP. Now, that program they came out with, and they had $300 million, maybe $350 billion. And they had more sign up than they had dollars. And so there was a pause there of about 2 weeks where if you didn't get it in, you just were out of luck. So then they appropriated another, I think it was $496 billion, almost $500 billion. It's still open. It's still out there, and it's still open. If you don't think you qualify, but really you could possibly qualify, but you really don't know how to fill out the form to make it official, call them. Call them, follow their websites and call them, and ask them to help you through the whole process of how you have to fill out the application. But absolutely, remember, it's still available, and we want all of our businesses, and it doesn't matter how small you are. I mean, for crying out loud, if you're running a little family produce deal, where you're growing a little sweet corn and potatoes, and you're growing some broccoli and different peppers and tomatoes, and you do that every year within your business, and you pay your family to take care of the stuff and help you, get rid of the weeds and do all the stuff that you do, and pick the corn and cool the corn down and put it in crates and all that you do. Just think about how you can propose that business to the SBA on the phone, let them help you walk through that and everything. And who knows, you may very well qualify, and it may be something that is significant to your family in every way. It doesn't matter how big or how small. If you absolutely haven't applied, I urge you to do so. Last things are pretty simple, and that's just this. Again, I tell you over and over and over about the census. We got to be counted. There's 3 things that there's more than 3, but 3 big things that are coming out tomorrow. Now, not coming out that we're going to start them tomorrow, but coming out with dates and guidelines and thoughts, and that is, we're going to give you some real updates on our pools. We're going to give you some updates on the bowling alleys, and we've got a thing that we're working on right now to be able to give a significant discount to West Virginians on our state parks, but we're going to announce it, and we need just the time to refine that and come out with that tomorrow. Like I told you, I said this about the census. Please, you can't imagine how important that is to West Virginia. We've got to all be counted. Please help each other. I mean, come on now. We've really got to get counted, or we're going to shortchange ourselves millions and tens of millions of dollars. The last thing I'd say is, yesterday I brought this up, but our local health departments, and I went through all kinds, whether it be, our first responders, or, really our grocery workers, or the fire or police people and all that kind of stuff. And everyone all these people on the front lines have done phenomenal work. I again tell you just how great our local county health departments and our local, health officials have been. They've done great work, and all of them, and I can't say enough about our nurses and everything else, but our local people deserve so much credit, because they are our first line soldiers and everything, and you've done great work. So I really appreciate you. And the last thing I'll say is again, if we could go to these slides, our positive West Virginia positive growth rate, and that is daily. This is daily. And yesterday we were at 1.2%. We have absolutely just trended just perfectly, and that's what we want to continue right there. On our cumulative percentage, of total positives versus total tests taken, you see the line moving just the way we want it to move. Now we're down from yesterday, we were at 1.96. Now we're down to 1.93. Unbelievable. Yesterday I was on a conference call with the president, the vice president, and the First Lady Melania. And as they were going through everything, one of the things that was a big celebration, yesterday, look at our number, 1.93. Yesterday, New Jersey got to 12%. We're at 1.93, and so it was a big deal for New Jersey. The only other thing I'd say to you is just this, is, our active cases versus recovered, is still just widening, and that's all really good. Now we're at 497 active and 960 or 950, I can't see real good and all that, but 950 or 60 that have recovered, and that's great. And the only last thing I would say is just this. There may very well be those of you that are out there that are thinking, daggone, all this stuff that's happened and everything here, we have flus and we have, different things that attack us, and people die and everything else. But just how substantial is all this? And then all you got to do is just think of what President Trump has done. How President Trump has ordered us to stay home, has ordered all the different things. And then all you've got to do to really, really get a grip on this is to think back. Have you ever seen a time in your life, have you ever seen a time when we were hauling people to refrigerator trucks, one right after another, as fast as they were in New York? Have you ever seen a time in your life when today, as we celebrate today, our nation is losing an equivalency, I said this yesterday, of 5 major airliners going down every day? Have you ever seen a time that you've dealt with anything like this? A lot of people have done a lot of good work. I would tell you to continue to be worried and concerned. The good Lord is in charge. We all know that. but you have got to absolutely continue to be cautious. The very minute that you think, well, we really didn't land on the moon, and something just as crazy as that thought, the very minute that you start thinking along those lines is when this thing will really bite you. There's an old saying, the very second that you think you're the biggest and baddest in the neighborhood is about the time you're about to get your you-know-what whipped. And so I would just tell you, be concerned. Help the elderly. Do all the things that you've got to do. Absolutely take care of everyone around you, including yourself. Follow all the guidelines, and we're going to be fine. And we're going to get through this, and we'll be fine. But you absolutely have to know just this. And I equated to those 5 airliners as airliners that would be hauling 275 people and just choo and boom, and that's the end of them. 5 of them a day, Now just think about this just a second. What if it was an airliner that maybe you're used to riding on at one of our local airports? That maybe it was a jet that had 50 passenger jet. Do you realize how many jets that is in a day? If it was 50 passengers, it's 28 a day. Boom, 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 going down. This has really been something, and it is really tough. And for those that are out there that think, oh, well, this hasn't been blah, blah, and everything, don't think that way, please. So the long and the short of it is this: continue to be careful. Continue to really watch what you're doing. You've done great, West Virginians. Nobody's got a number like you got and everything, and that's sitting here in the East. I mean, you are sitting in the hotbed in the most vulnerable state of all, absolutely with the highest obesity, the highest diabetes, the highest chronic lung and heart problems, absolutely the state that could have been attacked like nobody's business, and look what you've done. You have absolutely knocked it out of the park, West Virginia. Keep it up. Thank you.
All right, thank you, Governor. Now let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. I want to talk first of all about our EBT cardholders. We've been working on an initiative to provide online purchasing options for West Virginia Mountain State electronic benefits transfer cardholders. That's the EBT card. Today, we're pleased to announce that EBT cardholders can now purchase food items, their online items, from Walmart and from Amazon.com using Supplemental Nutrition Assistance Program, or SNAP, and or the West Virginia Works benefits. This is a great option that helps our clients eliminate the need for face coverings and social distancing. They can purchase these items from home. Effective today, cardholders can make online purchases using SNAP and our West Virginia Works benefits at 2 West Virginia Walmart stores located in Elkins, that's a pickup only, and Martinsburg, which is a pickup and delivery site. On May 21st, Walmart will add online purchasing at additional stores across the state. So that's on the 21st, 2 days from today. Online purchasing with SNAP benefits on Amazon.com will be available at 4 p.m. today. This is a major step to help our clients gain access to food with increased protection for social distancing. Let me give you a report here. Again, we like to report the numbers and make sure we give the information that we have out. I realized yesterday that was a lot of numbers, so I'm going to condense this somewhat, and we're looking at ways in which we can add detail to the website. It's very difficult to put all of those numbers through an audio report. But 67 of our 94 assisted living facilities have responded to begin reporting, begin testing. We have tested a total of 2,803 to date, and that is 1,818 negative tests. We have 980 pending tests. There have been no new positives to date from that testing. So And then with regard to child care center testing, we have tested 723 staff members. 720 those, 21 of those are negative. We have 3 positives. We still have some pending results, but we have 1,444 individuals testing in the child care testing project. That's all I have. Kathy?
Super. Good afternoon. I first wanted to follow up on what the governor announced, which we were very excited about, which is the availability of remdesivir. In early May, the Food and Drug Administration issued an emergency use authorization for remdesivir for patients with suspected or confirmed COVID-19 with severe disease. At present, there is no indication for remdesivir in mild or moderate COVID-19 disease other than in clinical trials, where we're trying to learn more about this. And I think it's important to understand that early trials suggest that remdesivir may provide some benefit by shortening the course of illness, but we don't know the extent to which that happens yet, or the full benefit of it. But it is a new tool in our toolbox. So as soon as we learned about this, and as soon as it was being available, the DHHR, Bureau of Public Health, we did receive an allotment of remdesivir, and we rapidly worked with healthcare experts from around the state to develop a statewide protocol for both distribution of and use of the product. So it has now been distributed to hospitals for the treatment of seriously ill COVID-19 patients in accordance with the EUA. We have a system of hubs that then can work with smaller facilities who also would like to use the medication. So while there's a lot yet to learn about the effectiveness of remdesivir, it is good to have one more tool in our toolbox for use in seriously ill patients. And we wanted to really make sure that facilities and providers are aware of the protocol and the product. So we have sent that out to providers across the state and to hospitals across the state as well. And we really appreciate the partnership of the Hospital Association, the State Medical Board, the State Osteopathic Board, the State Medical, the West Virginia Board of Medicine, and others in getting that word out for us, and for partnering in development of some of those protocols. So we also want to take the opportunity to thank our hospitals and our healthcare providers as well for all that they are doing to address COVID-19. They truly inspire all of us, and their partnership is so appreciated. So we're just really excited about one more tool to have in the toolbox as we have our seriously ill patients in the state. The second topic I was covering today, and this has been such an important topic, I want to spend a little time with it, and that is the results of the executive order testing for the nursing homes. And I think I wanted to kind of give you the overview of what's that finding and some of the key implications of that. So interestingly, the elderly often show few or atypical symptoms of COVID-19, and that can delay diagnosis, as you know. And getting an early diagnosis can really have implications for infection control that are pretty important. We also know from experience that once COVID-19 is introduced into a nursing home and begins to take hold, then it really has the potential to spread rapidly and widely among both residents and staff. So before the executive order testing, and so from mid-March to mid-April, we had experienced about in eight long-term care facilities, had experienced outbreaks in those settings. And several of them, 4 of them especially, had been very large and involved more than 20 residents. So out of great concern over the health and well-being of our seniors in these facilities, Governor Justice had issued an executive order directing all of the nursing home residents and the staff to be tested for COVID-19. And as you know, we were the first state in the nation to systematically do this, and others are following suit. So we tested residents and staff in 123 nursing homes. This was no small feat. That included 9,000 residents and close to 14,000 staff. And so our first statement is thank you to all who took part in a really colossal initiative. It definitely took the work of many working very fast together. So here's what we found. I think the first finding of note is that the majority of the state's nursing homes, 71%, COVID-19 had neither previously been found nor was it found during the executive order testing. among either staff or residents. So 71% of our facilities have never found and did not find any additional cases with this testing. 6% of our facilities had already identified COVID-19, some of them experiencing large outbreaks. And so those we knew about before the executive order. What we found with this testing was that 23% of our facilities, about 28 facilities overall, were newly identified as having at least one individual positive for COVID-19. And that the total numbers that we found in that setting were in those 28 facilities, we had 31 staff persons and 11 residents newly identified as positive. If we look at the overall percent positivity of our testing initiative, of all the folks that we tested and what we found as positive, we found that an overall positivity of 0.18%. So 1/5 of 1% of the people that we tested were positive for COVID-19. If you break that down by residents versus staff, it's 0.12% of residents and 0.23% of staff. So less than 1% in each. The interesting things are when you start to look at these 28 facilities and who was being identified as positive. It was much more common to find new individuals that were positive for COVID-19 among the staff, about 3 times more common among staff than among the residents. In the majority of the 28 facilities, and 20 of them that had let me say this again. In the 28 facilities, 20 of them, the newly identified case was a single positive individual, either staff or resident. So the vast majority of where we found it new, it was a single positive resident or staff person. Some of those, about a third, had a link with another positive case, most typically not associated with the facility. And about 70%, we really had no identified source of disease where they might have been coming from. So we did do some follow-up testing with those individuals where there was an identified link. And we actually found that many of them very quickly were negative on the next test, and in some cases by serology testing as well. So of the 8, that was the 28 facilities where we found something new. Of the 8 facilities where we found a new outbreak, there were, which is defined as 2 or more cases. We found that the outbreaks that we were identifying were much, much smaller than the previous outbreaks that we had seen. So in these settings, they were 2 to 6 cases each. So they were very, very small outbreaks. And in 6 of the 8, they have had no additional cases, most likely because they really had that spread contained early, or because the cases themselves were not very infectious when they were asymptomatic. So in the sum of all of this, we really had found that when we found these outbreaks in this executive order testing, we again found more staff than residents who were positive. They were much smaller outbreaks. We saw very little spread further, and that was very, very encouraging with that. We also have learned a great deal from the fact these single positive cases that were not spreading to others. And we are learning and working with the laboratories to understand that many of those probably have either they are false positives or they have such low levels of virus that they're probably not infectious to others. But we have to sort those out carefully, because we always want to take caution to make sure that we do that work as well. So in sum, I think this work has been really, really helpful. We thank the Governor for his vision in doing this. We are learning a great deal more about COVID-19 in nursing homes. And we are also really had the opportunity to jump quickly on these situations where we did find individuals here. We're now working with our facilities to think through more about what's the right screening for staff in the future, and how do we make sure that we take these learnings forward. So thanks very much.
All right, thank you both. Next, let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. I'd like to quickly highlight a couple of key areas that the governor has us focused on for the next couple of weeks. First is PPE supply and production, and we are working diligently with prison industries and have begun to make reusable masks as well as gowns that will be used as part of our long-term surge supply going forward, as well as support to organizations throughout the state. Also supporting testing, as you heard from the governor, there'll be support to public health, local health department, and corrections for testing for the next couple of days at key facilities that require that testing, as well as about 65 National Guardsmen preparing to support this weekend's testing in Cabell, Kanawha, Mon, and Marion counties. In addition to that, some additional support to local health departments for testing at key areas going forward. Next is support to best practices, and a particular focus over the next couple of weeks will be supporting our businesses and sectors that open, as well as state government agencies that will begin to open their services back up. And the feeding program support will continue over the next several weeks, and as the governor stated, for seniors and our vulnerable children through the rest of the summer. And last will be long-term planning going forward. We'll continue to focus on these areas over the next couple of weeks and going forward. Thank you.
Thank you, General. Dr. Clay Marsh, our coronavirus czar, is also joining us today and is available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner today is Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, about a month ago, you said that you were confident the state could continue paying its bills and meeting its financial obligations through at least the first week in June. Now that we're a couple weeks away from that date, could you give us an update on that from your meetings with the revenue folks? How is the state doing financially? Do we have a new date that we're looking at beyond the first week of June?
Charles, I think we do. I think that we're probably doing a slight bit better financially than maybe what we anticipated, but it's still bad. I mean, when you get a cannonball to the stomach like this, and in the month of April, we dropped $192 million, I believe, and right now we're experiencing a time where there's a lot of dollars that are supposed to be coming in this week. Friday, the collections were really probably about 35% higher than what we anticipated, but, we've got this week and it'll all just kind of ebb and flow. But the net of the whole thing is this: I think that we're positioned now to be able to have enough cash to be able to get us to the end of June, and we're monitoring it every day. We're still awaiting the guidelines to change to where we'll be able to start really genuinely backfilling revenue, and we're already going through and submitting things that to where we can bring back some dollars on the guidelines that we have right now. And we're dealing with the same guidelines that the cities and the counties are dealing with, and so therefore it's it's more restrictive right now. But I think we're okay now until the end of June. But we still stand ready to if the guidelines don't change and the numbers would spiral really badly, we're going to have another meeting today at 3:45 with the revenue people, and they're going to update again today. And so the long and the short of it is we're monitoring it and watching it. If we have to call our legislators back into session, we'll do so. But I'm very hopeful that we're not going to have to do that, and the guidelines are going to change and to where we can move forward and really help our counties and help our cities in a big way, and as well as making our state whole. But anyway, thank you.
All right, thanks, Charles. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. Beyond PPP and the $1.25 billion from the federal government and the SBA, all of that is obviously very important when it comes to our small businesses. But can you talk about what is specifically being done behind the scenes to help small businesses through this, especially the restaurant industry? There are some reports out today that really show a bleak picture for how they're going to rebound from all of this. And also what's being done to bring industry here. I know there's two major working parts to that, but the future is in those small businesses in so many ways. So what kind of things are being done to make sure that they're going to be okay in the long run?
Well, Amanda, first and foremost, from the standpoint you hit the nail on the head, the first thing that small businesses need to do is take advantage of, as I said earlier, about the PPP or the Small Business Administration loans that are forgivable. Right behind that, they need to be looking at the Main Street loans, and those Main Street loans are not forgivable, and the guidelines on how you can go into that system and everything are not out yet. You know, we're watching that like a hawk and everything. But those Main Street loans, as I understand it, the way that's going to flow is the first year. You know, there's no interest or no payment that's required in the first year, but you have to pay the loan off in the second, third, and fourth year. So it's a very low interest rate. All that's great and everything, and it may be helpful, but you can't get in a situation where you can't pay the loan off and everything. And the other flip side to that is just this: is there could be a part of those loans, and it's nowhere close. Don't put this in the bank at all. But there could be a part of those loans at some point in time that the government could move in and say, we're going to forgive a piece of this. Now, from the standpoint, you asked a lot of questions and everything, but from the standpoint of the restaurants, you know, the outlook is bad. I mean, there's no question the outlook's bad. But our federal government is still out there, you know, circling to be able to do more and more and more to be able to help that industry. Now, from the standpoint of just this, here's one thing that could be coming very soon. In the PPP loans today, those loans, you have 8 weeks to basically distribute those dollars to where those dollars, 75% of them are going to payroll and insurances or whatever that are connected to payroll. And if you don't distribute the monies, then you're in a situation where you got to pay them back. Now, the other flip side of it is this. I think now, don't hold me to this, but I think the rules have changed again to where the percent that they, you know, let's say you got a loan for $500,000 or $100,000. Let's make it easy, $100,000. And you were paying back, you had to pay $75,000 of that to payroll or payroll related. And then what happens is, as you go along and everything, you only could pay in your 8-week period $65,000. Well, originally you had to pay it all back, but now the way it works, I think, is the percentage that is funded is not required to be paid back. So there's a change there, and also they're working on lengthening the 8 weeks. It has been proposed by the restaurant industry to lengthen that 8 weeks to 24 weeks, in which it gives us a lot more latitude there. There's a lot of stuff, and we're working in every angle to help our small businesses. We'll continue to do so in every way. You know, we're working with, you know, our federal legislatures as well, whether it be our senators or our congressmen or women, and you know, so there's a lot that's still untold in this story, and there's a lot more of the story to tell. And as we go forward, you know, I really believe that you're going to be able, you know, you're going to be able to do a lot of different things that we can't do right now. Plus the fact that they'll end up probably being another stimulus package that'll come out and everything. And I just hope and pray that it's not jam full with this bunk and everything from the standpoint of, you know, illegal aliens or whatever it may be, you know, climate change or anything that Nancy Pelosi could come up with. But I hope we don't have that.
All right, thank you, Amanda. Next, let's go to David Beard with the Dominion Post.
Hi, this is David Beard. I have a sports question I'd like to ask, and also have a little curiosity question I want to slip in. The sports question comes from our sports department, obviously. What's the status of the high school summer workouts that typically start in mid-June for football, basketball, and so on? Are you going to allow them to start up maybe with some restrictions, or are they going to be delayed or canceled? That's that question. And then the other one is, Mylan is one of the companies that partners with Gilead to produce remdesivir. I think they make it over in India. I was just curious if our allotment came from Mylan. Thanks.
David, I can answer the first question, and I'm going to have to hear the second question, or maybe defer it to somebody else. But the first question is this: you know, that's an SSAC call. I think Bernie does a fabulous job, and he's looking out for our athletes and looking out for our instructors and all that kind of stuff. But that's going to be an SSAC call through and through, and I'm sure they're going to have guidelines, and they're going to restrict workouts to so many kids at a time or whatever like that, and we'll work with them, naturally on their guidelines and everything. But they do great work. They're going to do the right thing there, and they're going to protect our kids, and it's just all the time. I just can't say enough. They do really good work. But the second part of your question, David, if you want to try that one more time.
Sure. Mylan is one of the companies that partners with Gilead to make remdesivir. I think they make it over in India. I was wondering if anybody knows if our shipment came from Mylan or was from one of the other producers.
Governor, I can address that one if you'd like.
I'm sorry.
This is Kathy. I can address that one if you'd like.
Okay, Dr. Slim, go.
Yes. It's a great question. I actually don't know. Gilead donated the supply to the federal government, and then it has come directly from HHS. So we will have to find out a little more about where it got who was linked into the manufacturing.
All right, thank you, David. Next, we'll go to Mark Curtis with Nexstar Media.
Governor and everyone, good afternoon. Mark Curtis, Nexstar Media here. Governor, I know that Workforce West Virginia, with the great assistance of the National Guard, has processed over 170,000 unemployment claims, but we're getting contacted daily by dozens and dozens of people who still have no benefits, still have no checks. I know there are two Facebook pages now. One's called WV Unemployment Discussion, and the other is put up by WV House Democrats. And again, I can't quantify, but I would say it's in the dozens, if not hundreds of people who have still not gotten any benefits or were denied, or they got partial benefits with the current check, but no back pay. There seems to be a lot of people out there hurting that still haven't gotten help despite the processing of all those claims.
Mark, I've said it over and over. I couldn't be more sincere than just tell you just this. If we've got one person out there that's hurting, that has a legitimate claim, and is absolutely out there hurting, that hadn't been processed, or maybe falls into the frustration of maybe not being able to get somebody to give him the answers or her the answers and everything to help him, that's not good enough for me. We want to make sure that we help every single West Virginian in every way to get through this. But I would just tell you just this. From the standpoint of what we're doing, we've processed over 200,000 claims, or there's been over 200,000 claims. And absolutely, now think about it. A typical March, because I know those numbers, was 3,400 people. Well, we've had 200,000. And in 200,000, you're going to have problems. You're going to have issues. Now, I don't expect anyone to say, well, okay, Governor Justice, that's okay. I don't expect you to do that. I hear your frustration, and I will continue to bombard these people to keep doing more, and not rest until it's done, until it's over. So all I can tell you is, if in fact we've got people, every state, everywhere, has tons and tons of issues with this very thing. And understand too, we have administered and paid out in excess of $500 billion. $500 billion. $500 million. I'm sorry, $500 million. But still, it is $500 million that we have processed and paid out and everything. There's a lot of people that are doing a lot of good work, but really and truly, if you're the one that's sitting there and hadn't been paid, then it doesn't matter that there's a lot of people doing good work. We got to get you paid, and I get it, and I'll just keep pushing.
All right, thanks, Mark. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8, Fox 11 in Charleston. Governor, we've had holidays during this pandemic and the shutdown, but coming up, we've got Memorial Day, which is traditionally the kickoff of summer. Many people have contacted me about how should they proceed? What's the best way? I mean, do you fall back on the adages of social distancing, sanitize, and be safe? Or do you have something specific for this holiday in which, traditionally speaking, we get hundreds of thousands of people out and about celebrating the beginning of summer, doing any number of recreational activities, which up till now have been banned or not allowed? So, what can you tell people about this upcoming Memorial Day holiday? They can celebrate it safely and yet still mark the beginning of the summer season.
Kenny, and I want everyone to really, really listen to me right now. What would we do if we were invaded by another country? This situation is something that none of us have ever experienced in any way. I know it's really different. And I know that Memorial Day almost signifies summer's here. And I know that everybody is dying in every way to enjoy the summer and celebrate just that time that you have with kids and everything. I got every bit of that. But at the same time, West Virginia, you better listen to me. You've got to know that this situation is all hands on deck. This situation is something that you absolutely can do something about yourselves, and you already have. And if you absolutely believe that, summer's here and we can just do what we want and we can go everywhere and we can totally ignore this situation, it'll bite you, and it'll bite all of us. And so, absolutely, I hate it. I hate it that it's here, but it's a killer, and it's here. And we as West Virginians have got to do something about it. That's all there is to it. And so I hope to goodness that everyone will continue to be smart and be on guard and be cautious and be concerned. But at the same time, I hope that you'll enjoy what we are able to allow you to go out and do. Go out and enjoy the things that you do, but just be smart. And every day we're getting closer and closer and closer to the remedy. And the remedy is just one thing, and that is just this. We got to have a drug that gives us the vaccine, that gives us the ability to make this go away. We're closer. We're closer, and we just got to stay on top of it, and we got to really be cautious until we get there.
Thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. This is a question for Dr. Marsh. You talk a lot about the R-naught value, and I was wondering if we could talk a little inside baseball here. Can you take the available statistics that we have and what we've accumulated over the last 2 months and make an educated guess as to how many maybe untested people would be positive? Can you extrapolate on that? Or how many asymptomatic cases that may be out there, or how many may be contagious out there? I guess I'm looking at the minefield out there and asking you to give me a read on that, Doc.
Governor, you good for me to go?
Go, sir. Go, please.
Okay. So thanks for that question. And I think that's a really important one. And as we look at the R-naught levels and look at the case positive rates as the governor goes through every day, we know that West Virginians have done a really good job with this virus. We also know, as the governor just said, that this virus is omnipresent. It's present everywhere. And as we start to look at the future, we do see that there are a number of manufacturers that are coming out with vaccines that are showing some really important optimistic findings. Recently, one by a company named Moderna from Cambridge, Massachusetts, showed that in injections in several dozen people, that they had 8 people that generated very strong antibody responses that blocked the virus from being able to enter a cell in a laboratory setting. So these treatments are on their way. You know, Thomas Puyo, who is an author that I like, would argue that the number of people infected with COVID in a state or a community is 800 times the number of deaths. And these are deaths from community acquired locations. So, as we look at West Virginia, we know that we have many more people that are infected than we have been able to test for, even though we've been testing really well. And we also know today that people on the right at the interface of going from not symptomatic to symptomatic seem to have the highest titers of virus. So in that sort of 0.5 to 2.5 day window. And as you rightly point out, we can't easily discern who has virus and who doesn't have virus. And as we're opening up the state, and we'll have people come into the state from places that have more incidence of virus, and we particularly look at the Eastern Panhandle and Northern Virginia, Maryland, Washington, D.C., right across the border, then we know that we are going to have our people come into closer contact with the virus. And while we'll be watching each county, and we'll be watching that R naught level at the county level as well as the state level, we also know that the most important thing to do is to consider that anybody that you come into contact with that you don't live with closely and around all the time, that you need to be really careful around. You need to keep your space, your distance. And we know that a 6-foot distance really helps. And I think that it's really, really important. The governor stressed this, but I want to re-emphasize this, that we know in other countries that have come back together, that are living more normally, that wearing face masks and face covers are so important. And we also know that the face mask and the face cover doesn't really block you, the person not infected, from getting the virus, as well as it blocks you, the person who is infected, who doesn't know you're infected yet, from being able to spray out droplets. Because we know now just normal talking will spray droplets that can stay airborne for up to 14 seconds. Yelling, screaming. We know a choir practice in Washington State infected about 3/4 of the group because of this spray of somebody who was infected and didn't know it. So the key for us is not only to try to watch and look at the future and try to make those judgments, make those projections, those predictions, but it's really about us protecting ourselves, because as we protect ourselves, then we protect our family, our community, our vulnerable people, our hospital systems and frontline essential workers, but we also protect the state of West Virginia. And I think that people have done such a great job. So thank you for the question. We will continue to expand our testing and try to define that even more closely. But today, the key is take care of yourself, protect our state as we open up, and continue to be the beacon for others.
All right, thank you, Paul. We have time for one more. We'll go to Anthony Izaguirre with the AP.
Can you say why you don't think the inmate testing positive is connected to the correction officer testing positive?
I think the very best thing is for Brian Abraham. Brian Abraham, my general counsel, has got more knowledge on this and everything and that particular thing, but he can give you a good answer on that, I think, Anthony.
Anthony, in reviewing the matter with Department of Corrections and DMAPS this morning, the local health officials believe they have identified person 0 in that case, that they know the source that brought the spread into the facility. One of the things that we should be mindful of is DMAPS has been already using a precautionary preventative measures in place since day one. They're using CDC guidelines. These individuals that were contained within a particular unit, those units are segregated from others and don't intermingle. So they think they have identified the location, they've identified the individuals. They are putting other protective measures in place, such as the inmates wearing protective gear to prevent any further contamination. And again, we began immediate testing of all the individuals there at that facility. So they think they have already been able to identify, and it is not the person that we spoke of yesterday.
All right, Governor, back to you.
Well, really and truly, I don't have anything to end up with today other than just tell you to keep the beautiful lady, that 86-year-old female in Kanawha County that we lost, in your thoughts and your prayers, and as well as the other 67, a total of 68 people, and I would just end by just saying this. I go over it all the time, but I just ask you, West Virginia, to continue to just do the greatness that you're already doing and that you've already done. It is an amazing story. I mean, if you'll just step back from it and just think, we're within a rock's throw of 2/3 of the population of this country. And we sit right there with numbers, and we have sat right there continuously with numbers that are miraculous. I mean, that's all there is to it. They're a miracle from God, and a miracle from you, West Virginians, is what you've been able to do. You know, we're going to be okay as a state, and we'll try every way we possibly can to help our businesses and our counties and our cities in every way. You know, I am absolutely confident can be, as being a business guy that's been through a lot of rough roads through all my life and everything, that absolutely conditioned me to be able to be right here. And I believe that God above put me in this position. And that's why I'm honored to be here. And we're going to continue to do our job to the very best of all of our abilities. I know there's going to be some rough seas still in front of us. We're not through this yet, West Virginia. But please continue to help us. And I know you will. Keep us in your thoughts and your prayers. And I'm surely going to be in, and having thoughts and prayers for all of you. So God bless you, and thank you for the great work. Thank you.